Chronic subdural hematoma is when patients age, the brains tend to atrophy.
Subdural hematomas are a major problem for elderly populations in particular, but as people age, the brain shrinks from just aging atrophy. There's more space between the brain and the skull.
As you age, people fall, they slip on ice, all kinds of minor things, and even times not any major trauma. These bridging veins can stretch and bleed, and so it causes blood to accumulate in that space.
But what we're finding, a lot of patients are on blood thinners now because of pacemakers, various forms of cardiac arrhythmias, stents, whether it's cardiac or outside the heart. And so we've got a lot of patients, aging population, on blood thinners, getting brain bleeds. They are the most common form of brain bleed that we see through our ERs. It plagues neurosurgery clinics because these patients end up requiring extensive follow-up because up to 30% of them will have another bleed in the future.
Sometimes we can just have it treated without surgery, directly with middle meningeal artery embolization.
This artery that's in the head but outside the brain, it feeds that dura, the lining of the outside of the brain. By cutting down the blood supply there, what we're doing is stopping this repeat bleeding that happens in these patients. What's great about the procedure that we have now is we have a better understanding of what causes subdural. Simple procedure, done within 2 hours. Patients go home the next day if their other problems are managed. So it's a very exciting procedure for us because technically it's relatively straightforward and it makes a huge difference in these patients' care. This decreases that risk of repeat bleeding from 30% down to 4 to 5%. It's a dramatic difference. The long-term benefit for patients is huge. It'll still take 3 to 6 months for that hematoma to go away, and so they'll still have regular follow-up with their neurosurgeon. Angiograms don't typically require being in the hospital for more than 24 hours.
We like to provide this service for people so they don't have to leave and go far distances and travel, because these chronic subdural hematoma patients can have lots of visits. We have a great group of people here that are very well trained, and most importantly, that work well together. I believe that we keep that circle of communication nice and tight to make sure our patients don't fall through the cracks, that we're making sure that we're not just rushing into a procedure. We're talking about them and deciding what's the best procedure for this patient. We're not trying to push patients towards certain procedures because we can't offer other ones. We have a comprehensive neurosciences offering, and because of that, we can make sure they're getting the right treatment for the disease, the problem that they have.